let's see two questions related to oxygen therapy management. A nurse is checking the arterial blood gas values of a patient admitted with shortness of breath, chills, and weakness. Find the abnormal values. Select all that apply. So here the nurse is checking the arterial blood gas values and the patient is admitted with shortness of breath, chills, and weakness. So of course there will be some changes in the ABG values. Let's see the values. pH 7.32. Partial pressure of oxygen is 56 mm of Hg. Partial pressure of carbon dioxide is 52 mm Hg. Bicarbonate is 30 milliequivalents per liter and oxygen saturation is 88%. To know this answer, you need to know the normal values. So let's see what is the normal value first. pH is 7.35 to 7.45, but here the pH is 7.32, which is less. That means there is an abnormality. Second one, partial pressure of oxygen. It should be between 80 to 95 mm of Hg. Here you can see it is 56 mm of Hg. So here, seeing this value itself, the partial pressure of oxygen, it is less than 60 mm of Hg. That is an indication of oxygen therapy. So here the partial pressure of oxygen is less than 60 mm of Hg. The normal should be 80 to 95. So here this ABG analysis itself is showing that the patient requires oxygen therapy. The next value, partial pressure of carbon dioxide, that should be within the range 35 to 45 mm of Hg, but here it is more. The carbon dioxide level is more, that is 52 mm of Hg. So that is also abnormal. The fourth one, the bicarbonate. Bicarbonate also has increased. It should be within the range 22 to 26 milliequivalents per liter, but it is 30 milliequivalents per liter in this patient. That is also abnormal. And the last one, oxygen saturation, the normal value should be 95% to 100%, but here the saturation is less than 90%. So it is given 88%. If the saturation of oxygen is less than 90% in the room air, at that time the patient requires oxygen. So this is also abnormal, and from the ABG values there are two indications also for the patient to get oxygen. One is partial pressure of oxygen, which is less than 60 mm of Hg, and oxygen saturation, which is less than 90%. So I hope you understood this question and how we have to think of oxygen administration. Next question, the nurse should select which color adapter in Venturi mask to provide 28% oxygen. So you know that Venturi mask uses adapters that are of different colors, and these adapters will be providing different oxygen concentration with different liters of oxygen. So you need to know the color codes. So here the patient is getting 28% of oxygen. So what should be the color of the adapter? Whether it should be red, yellow, green, or white. To answer this question, you need to know the adapter's color, the oxygen concentration which it provides, and the oxygen flow rate. If the adapter is green, it provides 60% oxygen with a flow rate of 15 liter per minute. Red, 40%, 10 liter per minute. Yellow, 35%, 8 liter per minute. Orange, 31%, 6 liter per minute. White provides 28%, 4 liter per minute. And light blue provides 24% oxygen with 2 liter per minute. For the answer for this question is white, 28% oxygen concentration it provides at 4 liter per minute. I hope you understood this answer. Please do subscribe for more videos. Thank you.